I am Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Heavy periods can be a real problem, and identifying the underlying causes to reach to a conclusion to get the right kind of treatment is a very important aspect. Today we are going to discuss the list of reasons why you could be having heavy periods. The first is hormonal imbalance. Dysfunctional uterine bleeding is a term often used when no specific cause for heavy bleeding is identified. It is commonly associated with hormonal imbalances such as anovulation. Next is uterine fibroids. Uterine fibroid can be a very big reason for irregular periods. These are benign, non-cancerous masses which are growing inside the fibroid, and depending on where they are present, the size, the number, the location, the fibroids can cause severe to mild or minimal discomfort or disruption in the period cycle. If it is present in bigger numbers or a larger size, then the damage can be more and heavy bleeding can be one of the side effects. Adenomyosis. This is a condition where the endometrium, the inner wall of the uterus, grows inside the muscular wall of the uterus. This causes tenderness inside the uterus and can also result in heavy bleeding. Endometrial polyps. Polyps are harmless, non-cancerous, just masses which are growing on the outer wall of the endometrium. That is, inside the endometrium, these are small masses. They are usually non-cancerous. These can also cause heavy bleeding. Polycystic ovarian syndrome. This is a condition where there is an imbalance in androgens, due to which the normal functioning of a period cycle is disrupted, and there could be heavy bleeding whenever this PCOS patient has a period. These patients typically have acne, they are overweight, they have excessive hair on their body. These are indicative of polycystic ovarian syndrome. Not only this, whenever they have their period after a long duration, the period could be heavy as well. Pelvic inflammatory diseases. Infections of the reproductive organs such as pelvic inflammatory disease can lead to inflammation and contribute to heavy menstrual bleeding. Then there are some medications. Some medications such as anticoagulants, anti-inflammatory drugs can contribute to heavy bleeding. If you are experiencing heavy bleeding, it's very important to consult your gynecologist or obstetrician. They will perform a scan, a number of tests, because especially if it is cancer, also heavy bleeding can be one of the indications that can push them towards a cancer investigation, depending on the age and the kind of bleeding that you're having. So if it is irregular, if it is heavy, even if it is for a few times, you must consult a gynecologist. They will perform the necessary investigations, the necessary ultrasonography tests, and come to a conclusion that it is normal or abnormal. To understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.